My name is Hayfever from Mediapharm, in case you missed it, and I'm here to talk about hay fever and COVID-19. So why is it important to be talking about that now? The problem is a lot of people are mistaking COVID-19 symptoms with hay fever and also the other way around. So it's really important that we help customers understand which one it is, because then they can get the right treatment. So for example, if they've got hay fever, they think it's COVID-19, they may be suffering in silence, they may be actually sneezing and coughing and itching because of hay fever and making things worse and perhaps spreading COVID if they've got some. And also if they've got COVID-19 and they think it's hay fever, then they're not following the right procedures in terms of self-isolating and so on. So that's why it's important. That's why we're talking about it today. And it's something that the Allergy UK, the charity, has brought up also, because they've had a lot of inquiries about the two. So I just thought it was quite important to talk about it today in terms of what pharmacy can do to help. So how do we tell them apart? Well, the symptoms that are confusing for both are the headache and the coughing. I mean, mainly the coughing because of the persistent cough. Let's start with hay fever. So the hay fever symptoms typically are sneezing, itching, runny nose. There may be some cough with that, and that's because of the pollen catching at the back of the throat. And there might be headache because of the congestion that's associated with the sinuses and so on. And also, one of the big telltale signs about whether it's hay fever or not is it's seasonal. So at the moment, we've had a very high pollen count, and a lot of people have been suffering with it. So it's that's one of the other telltale signs. Is it timely? Is it something that they've had before? So if they've had hay fever before, ask your customers if they have, and just try and tease out those symptoms and those things to make you think actually it's hay fever, not COVID-19. At the same time, if it is COVID-19, it's the persistent cough that you've got to be concerned about. So if a customer comes in and says, I'm not sure if I've got hay fever or COVID-19 because I've got, I think I've got COVID-19 because I've got a cough, and actually they might have phoned you as well, because obviously they're probably aware that they shouldn't be coming into the pharmacy. But it's actually teasing out whether that cough is persistent and whether it's associated with fever. So with hay fever, there is no high temperature, but with COVID-19, there is. And also you get sometimes the headaches, the aches and pains, very much, like flu-like symptoms. So that is a way of distinguishing the two. So what should you be recommending and why? Why should we be treating hay fever? So hay fever, as I mentioned earlier, the customer is likely to be sneezing, and they're likely to perhaps be coughing as a result of that. They're likely to be having an itchy face. Now, if they're sneezing, that's one of the advice with COVID-19. If there is sneezing or coughing, you don't want to be projecting all the water droplets. So, you sneeze in, if you don't have a tissue and you bin it, catch it, bin it, kill it, then you use your, the inside of your elbow, your sleeve to sneeze. If you've got hay fever, you're also likely to be having an itchy face, itchy eyes, itchy nose. So again, one of the advice for COVID-19 is don't touch your face, because you could have touched something that has got COVID-19 virus on it, and then you're touching it and then you're infecting yourself. So that's why it's really important to treat hay fever symptoms. So not only to relieve the symptoms, but to also make sure that you don't, you're not affecting yourself, infecting yourself with COVID-19, and also you're not spreading it. Now, if it's COVID-19, if you suspect it's COVID-19, then you need to give them the latest guidance. That sometimes changes, so make sure that you are checking on the NHS website and also, the guidance that's produced by the PSNC in terms of what the latest guidance is. At the moment, it's self-isolation. So if you suspect you've got COVID-19, you self-isolate, and also with your members of the family as well. In terms of how you look after yourself, the general advice is painkillers, plenty of water, plenty of rest and sleep, and really just letting, the same way as you would treat a flu. So obviously if symptoms get worse with COVID-19, then you need to advise them that they need to ring up NHS 111. The thing that complicates it with hay fever is some people that have got hay fever also have asthma, because it's a related condition. So it's important that people with asthma are seeking medical advice. So always get them to ring up NHS 111 because obviously one of the complications of COVID-19 is respiratory symptoms. So it's making sure that their asthma is well controlled, and also actually if they have got any signs of COVID-19, everyone is paying attention to that so that they know when they need to seek advice. So that's, in summary, the difference between symptoms of COVID-19 and hay fever. So it's the cough. COVID-19's got a persistent cough. Hay fever has got an intermittent cough, and it's associated with pollen getting to the back of the throat, or it might be just sort of nasal drip as well, getting to the back of the throat. And the other thing with COVID is the fever, which you don't get a fever or a temperature with hay fever. So in terms of Q&A, so I have pulled together some questions from various people that have contacted us, and also some of the questions that have been posted by Allergy UK. So one of the questions is, do anti-allergy medicines have a negative effect on immunity? Now, it's a really good question. Most anti-allergy medication don't have any effect on immunity. So your customers can safely take, their regular antihistamines, and they can also take their inhaled steroids, their nasal sprays and so on. So that's fine. The problem is with it's oral steroids, which they'd only be able to get on prescription anyway. That can dampen down the immune system. But in terms of OTC, the important thing is for them to manage their hay fever symptoms. So if they're using antihistamines, that's great. If they're using nasal sprays or eye drops, then continue with that. That's not going to have an effect on their immunity. One of the other questions is, because allergy is related to the immune system, does having allergies, such as hay fever, make someone more vulnerable to COVID-19? And it's important to realise and explain to the customer that actually that is not an issue. It's more an issue with autoimmune diseases. So diseases that affect the immunity and can dampen it down. Allergy, in fact, is the immune system going into a bit of hyperdrive. And it's about the immune symptoms being exaggerated, or the immune response being exaggerated, and that's why it produces these symptoms of runny nose, itchy eyes, and so on. So actually that's a sign that the immune system is working. So it does not put people in any vulnerable situation to COVID-19. So that's fine. That's a really important thing to reassure customers. The other thing is, some people are saying, what do I do if I'm self-isolating and I have an allergy? Well, or have hay fever. It's important to still get that anti-allergy medication. So the same as, the advice if you are self-isolating, in terms of getting, your groceries and everything else, you need to get someone to, bring you some medication. And obviously some of the pharmacies are offering that, perhaps working with volunteers or just continuing their medication delivery. And it might be that you're extending that to over the counter as well. So that's it really. So I have come to the end of this. I think really the main thing to remember is, in summary, at the moment we are in peak season for hay fever. So the pollen count, I know a few days ago, was hitting the roof. So people will be suffering from hay fever now, and that is going to start causing concern and anxiety about whether it's related to COVID-19 or whether because they have got allergies and hay fever that makes them more susceptible. So for pharmacy, it's really important to reassure customers that the symptoms between hay fever and COVID-19 are different, and for us to educate customers about how to pick out whether it's one or the other, so that they can take the right approach, they can take the right steps to either manage their symptoms of hay fever, or if it's COVID-19, to follow the correct procedures so that they are putting themselves in the right place. They are safe, and they're putting other people safety being considered as well. So thank you very much for listening, and I hope you found that useful, and I look forward to seeing you at the next one.